When to be reasonably certain that you are not pregnant, or that you will be pregnant, or that you are already pregnant after having an unprotected sex without taking any contraceptive measures. Hello guys, good evening. Welcome to today's health talk. So before we go into the main details, let's look at some key points that will help us to understand better what we are about to discuss. The first point we are going to look at is your ovulation, your menstrual cycle, your fertile window, and your non-fertile window, and the last timing of your sexual activity, or the timing of your last sexual activity. Now, what is ovulation? Ovulation simply means the release of mature egg or ova from one of the ovary, which occurs every month, or which occurs once in every month or every menstrual cycle in women of reproductive age, right? As long as you are still in your reproductive age, in the absence of pregnancy, you must surely experience ovulation unless you have any other underlying condition that might prevent you to be having normal ovulation. So this ovulation usually occurs in the middle of every menstrual cycle. Note that sometimes people get confused. When is my ovulation? Just know that your ovulation usually occur in the middle of every menstrual cycle, as long as you are having a regular cycle. What I mean by a regular cycle is your menses always comes with a steady number of days, with a steady length of days. You understand? Good. That's what I mean by a regular cycle. You understand? You usually see your cycle on the expected date. You understand? That's what I mean by a regular cycle. So as long as you're having a regular cycle, just know that your ovulation date usually occurs during the middle of your cycle, or 2 weeks before your next menstrual blood flow, right? Good. Now let's look at your menstrual cycle. We say your menstrual cycle is the length of time in terms of days, right? In terms of days, or in terms of day, right? From the beginning, from the first day of your current menstrual blood flow to the day before your next menstrual blood flow. For instance, if your the first day of your current menstrual blood flow started on April 1st, right? We know that April has a 30 days in total. So let's say it started on April 1st, right? And then your next cycle started on May 1st. It simply means that you have a 30-day cycle. You understand? So that's what I meant by the first day of your current menstrual blood flow to the day before your next current menstrual blood flow. That's what we mean by your menstrual cycle. Now, what are your fertile windows? Your fertile windows are derived from your ovulation dates. Just know that. Yes. For instance, let's say that you have a 28-day cycle, right? You have a 28-day cycle in which your ovulation date is expected to be on the 14th day of your menstrual cycle. Now, your fertile window, or your fertile period of fertile days, are going to be 2 to 3 days before that 14th, which is your ovulation date, or 2 to 3 days after 14th. You understand? That is to say that your fertile period in a 28-day cycle, in a 28-day cycle, in which your ovulation is on day 14, your fertile period, or fertile window, begins on 12th, 13th to that 14th. Then your fertile period also continues from 15th, 16th, 17th. You understand? So now day 11, day 10, 11, day 18 and above can be considered as your non-fertile cycle, or period when you are less fertile. You understand? Because they can be considered as your less fertile period when you are less fertile. What I mean by less fertile is when it is rare, like is not like the possibility of you getting pregnant. It's not like you will not get pregnant, but it's just that the possibility of you getting pregnant in these days is kind of limited. But just know you can also get pregnant. In everything, abstinence is the best. Just know that abstinence is the best. So when we say abstinence is the best, it simply means that for the fact that you don't want to have a baby, or you don't want to get pregnant, and you don't have any contraceptive method of preventing pregnancy, right? Abstinence is the best. You understand? Good. Now let's look at the last key point, that is the timing of your last sexual activity. What we mean by the timing of your last sexual activity simply means the last time or the last date you had sexual intercourse in your menstrual or in a menstrual cycle. So with that being said, let's go back to the main discussion to the main discussion of today, right? That is when to be reasonably certain that you will not get pregnant, or that you will get pregnant, or that you are already pregnant. So how can you track if you will get pregnant, or that if you are already pregnant, or that if you will not get pregnant after having an unprotected sex without having to wait for 1 to 2 weeks for the hormone to. So in everything, for the fact that you don't want to get pregnant yet, and you are sure that you don't have any contraceptive method of preventing pregnancy, right? Like you don't have something like an IUD or the implants and all those things to prevent pregnancy. Abstinence is still the best option. So for that, with that being said, let's go to the last key point. That is the timing of your last sexual activity. This simply means the last date you had sexual intercourse in your menstrual cycle. So with that being said, now let's go back to our main topic of discussion. That is when to be reasonably certain that you will not get pregnant, or that you are not that, or that you will get pregnant, or that you are already pregnant. Now, when will you be reasonably certain that you will not get pregnant? Now we are going to be using these key points that we already talked about, right? Especially your ovulation. So let's use, for instance, let's use, it's not, let's, for instance, let's use a 28-day cycle. It's not like you can't use other cycles. Remember what I told you earlier. It doesn't matter the length of your cycle, as long as you have a regular cycle, you can still calculate it the same way we are going to do in this video. This is just for a clear understanding purpose, right? So for example, in a 28-day cycle, right, is expected that your ovulation date is on the 14th, right? Now, let's say that your last menstrual period was 10 days ago, right? Let's say that your last menstrual period was 10 days ago, and you had an unprotected sex without taking any contraceptive measure 3 days ago. How do you know if you will get pregnant, if you are already pregnant, or if you will not get pregnant? So how to know if you will get pregnant or if you not get pregnant? Now, with that, it means that you had an unprotected sex, right, on day 7. Yeah, it means that you had unprotected sex on the 7 of your menstrual cycle. Because remember, the information is that your last menstrual cycle was 10 days ago, right? And that you had an unprotected sex 3 days ago, which means you had an unprotected sex on the 7 of your menstrual cycle. Remember, your ovulation date is on the 14th for a 28 days cycle. So having an unprotected sex on the 7 of your menstrual cycle doesn't, or is reasonably certain to say that you will not get pregnant. Yes, because the space from that day 7 to your ovulation date is very far. So definitely you will not get pregnant. So now let's use another example. Let me say, for instance, your last menstrual period was 12 days ago, right? And you had unprotected sex 3 days ago, right? Will you get pregnant? So from the information provided now, it means that you had unprotected sex. That should be on ninth of your menstrual cycle, right? So you will not get pregnant because the space from that ninth to 14th, which is your ovulation date, is still very much far apart. So definitely you will not get pregnant. So you can only get pregnant if you have sexual intercourse in days that are 2 to 3 days closer, or 2 to 3 days after your ovulation date. That is to say that you will not get pregnant in a 28-day cycle if you have sex on day 7, day 8, day 9, day 10, and day 19, 20, and above to your next menstrual cycle. So you will not get pregnant if you engage in sexual intercourse without taking any contraceptive measures in any of these days. It's not that you will not get pregnant, right? Just like we told you, abstinence is the best, but it's just that your chances of getting pregnant is very low. So it's reasonably certain to say that you will not get pregnant. When to be reasonably certain that you will get pregnant after having an unprotected sex without having or without taking any emergency contraceptive measures. So now, for instance, let's say that your last menstrual period was on was 17 days ago, right? So let's say that your last menstrual period was 17 days ago, right? And you had um, unprotected sex a day ago. You understand? That is to say that your last menstrual period was 17 days ago and you had unprotected sex a day ago. Remember, your cycle is 28 days and your ovulation is supposedly on the 14th day, right? Good. Now, it means that with the information provided, it means that you had an unprotected sex on the 16th day of your menstrual cycle. So now, having an unprotected sex on the 16th day of your menstrual cycle, the space or the window, right? The window between your ovulation day and that 16th is too close. You understand? So now, to answer that question, will you get pregnant? Definitely you will get pregnant. So now, if you fall in this category, or if this has happened to you before, or in case if you experience this in the future, you need to take an emergency contraceptive. It will work because the time is still close, right? So you need to take an emergency contraceptive. So now, let's give another example. Let's say that your last menstrual period was 20 days ago, right? And you had unprotected sex, right, 4 days ago, right? Will you get pregnant? Right? Good. So now, to answer this question, it means that you had unprotected sex still on the 16th day of your menstrual cycle. So definitely you get pregnant. So now, to summarize when to get pregnant, right, in a 28-day menstrual cycle, right? If you have unprotected sex without any taking any contraceptive measure on the 12, 13, 14 of your menstrual cycle, and dates 15, 16, 17, and possibly 18 of your menstrual cycle, the possibility of you getting pregnant is much high, because these particular dates are known as your fertile window or fertile period in a 28-day cycle. So that is when you will be certainly, or when you will be reasonably certain that you will definitely get pregnant, right? After having an unprotected sex without taking any contraceptive measure. So now, when will you be reasonably certain that you are already pregnant? Is reasonably certain that you're already pregnant. For instance, let's say that you saw your last menstrual period was, let's say, 26 days ago, right? Your last menstrual period is 26 days ago, and you had an unprotected sex 11 days ago. Remember, your last menstrual period was 26 days ago, and you had unprotected sex 11 days ago, right? That is to say that you had unprotected sex on the, that should be on, okay, on the 16th. You had unprotected sex on the 16th of your menstrual cycle. Definitely you are already pregnant. You are already pregnant because when you are, the time frame between which you are able to figure it out is already far apart. So pregnancy have already occurred. So it is reasonably certain to say that you are pregnant, because having unprotected sex on the 16th in a 28-day cycle, in which the ovulation date is on the 14th, is reasonably certain that you will get pregnant. So you are already pregnant. I don't know if if I'm making any sense. So that is how to know if you are reasonably certain that you will get pregnant, you are not pregnant, or that you are already pregnant, right? Without going to a hospital to run a formal pregnancy test with blood or urine. Because oftentimes the HCG hormone is not detected in the blood or urine immediately after fertilization occurred. You understand? The fertilized egg has to be implanted in the womb, right? For the HCG hormone to now become present in the blood. And it even takes more few it even takes more days for it to be present in the urine. So with this method, you can be able to track if you are already pregnant, if you are not pregnant, or if you will get pregnant on time. So that if the time between which you are tracking this is still close, you can be able to get an emergency contraceptive pills immediately in order to prevent getting pregnant. Then if you are already pregnant, you can be able to prepare yourself, right, on how you are going to handle this situation. So thank you so much for listening to this health talk, right? I hope that this video will help you to be able to track your the possibility of you being pregnant, not being pregnant, and already pregnant on time. Thank you so much.